If you have low back pain, and especially if it's not radiating past the knee, what's causing the pain? When we think about pain, we want to think about all the different structures in the body that cause pain. That's actually one of my fascinations of why I'm in this field, is that there's many things in the body that cause pain other than just discs and nerves. Although nerves are always involved to some extent, there's many structures that cause pain, and they tend to cause pain in very predictable patterns. So for example, we can have the joints in the back where they don't move quite right. When those joints get stuck and restricted, pain oftentimes is the result. The muscles aren't quite working right. Many different things get out of whack, so to speak. In these areas, things like manual medicine, finding a great osteopathic physician who's osteopathic manipulation, perhaps a chiropractor, maybe even a massage therapist, a physical therapist who does manual medicine. For that type of pain, those types of treatments can be very, very effective. Also, in that kind of pain, there's also a fair amount of inflammation. Traditional medical care might have you put on an anti-inflammatory like Motrin, Advil, Naprosyn. Those can be effective as well, as can several different kinds of herbal remedies like turmeric, cap arrest, or some just to name a few. So there's still some other structures that are big culprits in low back pain. In addition to the joints not working, if you think about your body as having different bones that are put together that are then held together by rubber bands or ligaments. As those ligaments become strained over time, oftentimes we don't have our bodies in the best position to be able to heal. So what happens is when you strain those ligaments, they never heal right back up. And so what happens is over time, we start to lose a little bit of stability in the joint. Since that joint is just a little bit loose, the muscles have to work harder in order to keep your back stable. That starts to lead to muscle pain. In addition, where muscles attach to bone, we have what are called tendons. As those muscles are working harder and pulling harder, we start pulling on our tendons, and we start to get things like tendinitis or tendinosis. And so that's another big culprit, and the cause of low back pain is looking for these areas that are restricted, but then they're not just restricted, but they're actually hypermobile. The back is moving too much. The muscles are having to work extra hard to stabilize it. And in those cases, treatments like platelet-rich plasma, PRP, very, very popular treatment, and prolotherapy can be exceptionally effective, especially if you find a competent provider who can help you with that. Another great treatment for low back pain is acupuncture. Now, there's a couple of different views on acupuncture. One is the more traditional model, which would say that classically it would be described in the ancient Chinese texts as thinking about the human body as being composed of complex intermoving streams of energy. And when those streams and flow of energy becomes blocked, pain and disease are the result. So when those channels or meridians become blocked, pain is oftentimes the result. So then the needles are placed at specific sites in the body, and they open those blockages, allow that free flow of energy, and then the pain dissipates. Now, modern science tells us that with acupuncture, we have an increase in the body's natural painkillers or endorphins. That helps contribute to pain relief. We also know that with current research in dry needling or trigger point treatment, for example, that the acupuncture needles also work to deactivate the pain generators inside of the muscle. Finally, we get to diet. When we talk about diet, we're in a very pro-inflammatory diet in America. We're eating a lot of gluten, we're eating a lot of sugar, we're eating a lot of dairy. These things lead to inappropriate inflammation. So in some cases, not all, but certainly in some cases, a reduction in those can actually help increase your overall state of inflammation and actually help reduce your level of pain. So if you're suffering from sciatica, what I would encourage you to do is to find an excellent osteopathic physician or a physician who really specializes in manual medicine, who can look at you from the whole person perspective, who can evaluate whether or not this pain is coming from like a disc problem or a nerve problem that may need more aggressive treatment, or whether your pain is coming from one of these other very common causes that can be easily fixed without needing to resort to drugs or surgery.